don't look a bit like Neil.
Hello, I'm Natalie Bolton. I would just like to say that I think that even though it sounds as though quite a number of services have reported to you that they actually give help to severely ill people, I would question some of that help. For example, in our area, an OT came to visit my housebound, very ill daughter. She asked to be referred to them. And the woman came with a cold and fired questions at her for a couple of hours.
Really?
And left her very much more ill for several weeks. And although they were able to offer telephone counselling, she was completely unable to use a telephone.
Yeah.
So I think, you know, that research may still give a very distorted picture of what's actually happening on the ground.
Yeah. I think that's a really valuable point. Obviously, I can't comment on that individual circumstance because that would be not appropriate. But as somebody who's been very severely affected myself, I think what I would love to see is actually getting to a situation where the understanding is there right across the country in all areas that if one is working with very severely affected patients, we're often talking about minutes of contact that people can cope with. And that needs to be understood. And I would love to see patients and patient support groups taking part in planning services for the future.
Okay, question there. You've got the microphone, so you're on. Oh, okay. Sorry, I thought you were about to ask a question. Well, over on the right, Charles. Sorry, you.
Hi, Claire.
Hi.
I've thought about your 33% figure, and I think it's something that of services that don't provide a service for severe patients, and it is something we've used in the past, but I think we ought to make more use of it politically. I've often thought, and I can't think of any other sort of, recognised medical condition. I mean, if you compare it to MS or people with AIDS or anything else like this, where a service provider turns around and says, well, we're providing a multidisciplinary service for multiple sclerosis, but we don't see people with multiple sclerosis. I mean, it would just be regarded as completely unacceptable. Is it something that you actually chased up and thought about, and can you think of any other medical conditions that don't provide service for people with severe end of the spectrum?
That's a really, really good point, and these are conversations I've had with senior colleagues, and also some of the data collection was done by a fourth-year medical student. So this was presented to other medical students, and they were really shocked. We've talked a bit earlier about the need to educate medical students and doctors in training. And they couldn't believe that there could be a condition where people are so disabled, and if you're at home and you can't get out to a specialist service, you just fall off the radar. They thought, well, surely this can't be true. Well, actually, you know what? It is. Yes, please do. Please chip in, George.
That's a strong argument for a much more powerful political voice from patients, because it doesn't happen with any other condition, and it is happening here. So you've all got to get together as a group of charities and make that point. That's a powerful point. It couldn't happen in breast cancer or prostate cancer.
And this sort of data helps us do that. We have a question down front here.
As someone relatively new to this area, I just wanted to see if you could help me do the maths. As I understand, the figures often quoted that 250,000 people have ME, and the survey showed the 20% of it had it severely, and yet you're talking about 408 patients, and there seems to be a bit of a gap. I just wondered if you could just unpick that for me a bit.
Yeah, we've looked into the data a lot, and the only sound answer you can give is that we don't know. I think anything else is just guessing. I know I've had this conversation with Charles and with Sonia, wondering if perhaps there are figures from the patient support groups that could give us an indication of numbers. We just don't know, and I really do think that that piece of research is timely, that it needs to be done somehow, because otherwise patients just fall off the radar. If nobody knows how many patients there are out there, there is a temptation to act as though, this is a tiny problem, it doesn't affect many people. We know it's affecting a lot of people, And I think that needs to be actually quantified so we can make a strong case for it, I feel personally.
We have an online question.
Okay, I've got a question here that asks, what do you think is the way forward and what care should be available for severe ME people?
That's a fantastic question. I'm a great advocate of patient choice. Having had the illness myself, I valued having a range of options to choose from. And I think often the illness is very individual. What helps one person doesn't necessarily help another person. And sometimes in the course of an illness, in the process of the journey towards regaining one's health, there are a variety of approaches which may help at different times and different stages in the illness. And I think that's really important. So that's to answer the second part of the question. We do need more research to understand what does help people, and I would love to see patients and patient support groups involved in planning that research, because I think it needs to be patient-centred. Yep, please chip in.
One thing that's absolutely essential is we make a proper diagnosis and we keep that diagnosis under review, because lots of people who present with very non-specific symptoms and you think they may have chronic fatigue syndrome end up with funny MS, they end up with psychological disturbances, and that picture emerges over time. So certainly everybody who falls into the category of severe MS needs continual review, they need a multidisciplinary approach, and they need to have some attention paid to them. And at the moment that's not happening. That's a basic minimum. When we have, hopefully in the future, with the help of people like Hugh Pelly, when we have better interventions, then they'll need treatment. But right now, they need to be counted, and we need to understand what the problem is, and we need to offer them long-term support and continual review of their diagnosis. That would be the least we should offer as a responsible, caring NHS, in my view.
You'll probably think I'm only picking people that are as far away from you as possible. The exercise is good.
Gregor Purdy. With my general practice background, I've found in my other area of interest, chronic pain, patients go into a specialist centre, they come home. That's it.
Sorry, I missed the last word.
Patients come into a specialist service, they have very intensive therapy, then they're discharged to the community.
Yeah.
For those specialist services that are discharging people, what links do they have with the community teams? What follow-up, what mentorship and support do they give to primary care physicians and nurses?
Yeah, I think it's a very good question, and one that needs an answer. From specifically talking about this scoping exercise, we did ask some questions about how the service perhaps worked with other services, within the community. At the moment, the reality is so many services are really strapped for budget, and I think they would say that there's often the dilemma between how many patients can you help and can you offer ongoing help. But I think most of us with the experience of the illness know that the journey to regaining health is often a long one. It's not 6 weeks. It's not even 6 months. It's years, and actually having the support and the help at the points you need it in that ongoing journey. If you hit a relapse, you might have a bit of help and things go a bit better for a while, but then you hit a really sticky patch. And you need the help and support to get over that really tough patch at all levels. And that is one thing I would really like to see the NHS understanding, is that this is about long-term help. It's not about a 6-week package. Although in all fairness, services do vary a lot in what they offer, but it is a point that I think does need making.
Okay, look, that's great. I think what this does is tee up the conversations we're about to have. So look, we're really grateful for both the research and the findings. Thank you both.
Thank you.